So today we will speak about the brief about parasympathetic and the sympathetic nervous systems. Parasympathetic is more this one cranial and the sacral. Cranial is 3, 7, 9 and 10. So that is comes under parasympathetic. And sacral, then thoracic numbers, that is called is sympathetic. So this remember it is easy. So first comes the P and S. P stands for the top, that is called cranial nerves, and bottom is sacral. Then in center, thoracolumbar is sympathetic. So then one more difference will have this one major difference is the ganglions. In ganglions, the parasympathetic nerves are in parasympathetic systems. The ganglions are situated near to the organs, effective organs. That means the preganglionic fibers is longer and the postganglionic fiber is shorter. Same it opposite in case of sympathetic nervous systems. That is, preganglionic fibers are shorter, postganglionic fibers are longer because the ganglion situated away from the effective organs. That is the second thing. The next part is receptors. In this nerve and nerve, this one junctions, the receptors may reach acetylcholine in both sympathetic and parasympathetic. But in case of this one, NM junctions, in parasympathetic same acetylcholine. That's why it is called cholinergic. But in sympathetic, it is noradrenaline. The exception is sweat gland, which is in fact it is innervated by the sympathetic, but it has NM junctions, acetylcholines. That is basic functional mechanism of the structural mechanism and receptor mechanism of the parasympathetic and sympathetic. Then other part is action of the parasympathetic and sympathetic. In case of heart, the parasympathetic nerve these systems usually depresses the heart activities, but other parts it stimulates the activities. But in sympathetic, it again stimulates the heart, and in other parts it is depresses this. Other parts like this, it will tell you any bronchus, it will just causes the constrictions in the bronchial walls, and in case of sympathetic, it causes dilatations. In GI tract, it will causes constrictions of the gastrointestinal wall, parasympathetic. So when it will cause the constrictions, the motility will be in high rate. So that can cause diarrhea. So excessive action of the parasympathetic system on GI tract causes diarrhea. But in case of sympathetic nerves, it causes reverse way. So it causes constipations because it causes dilatation. So that means the motility is slower. So that can lead to excessive action of the parasympathetic sympathetic nervous systems in GI tract, it causes constipations. Then comes out the bladder, again same things. It causes constrictions, that means it causes increased urine output. But in case of sympathetic nervous system, same opposite, it reduces the urine output because it causes dilatations. Then in case of people's that is causes meiosis, that is constriction again for the in case of action of excessive action of the parasympathetic nervous system, and in opposite causes mediatrices, that is called mediatrice is caused by the sympathetic overaction of the sympathetic systems, so it causes mediatrice. And in case of glands, so again it stimulates the function of the glands parasympathetic nervous system, and it depresses the functional mechanisms by sympathetic nervous system. So this is basic difference between parasympathetic and the sympathetic nervous systems. Okay, thank you.